Hi, everyone. This is Rick Thomas with Thomas Family Insurance. I want to take a few minutes to talk with you about something important coming in 2026, especially if you're on a United Healthcare Medicare Advantage plan. And that's how referrals are going to work moving forward. This isn't meant to overwhelm you, and it's definitely not meant to scare you. My goal today is simple: to help you understand what's changing, why it's changing, and how to avoid unnecessary frustration or delays when you're trying to get care. Medicare rules change all the time, and this is one of those changes that can cause confusion if no one explains it clearly. That's what we're here for. As we go through this, I'll explain things in plain language. I'll tell you what you need to do, and just as importantly, what you don't need to worry about. And if at any point this feels confusing, remember this: you're not expected to figure this out on your own. That's why Thomas Family Insurance exists. Let's start with the basics. Before we get into the details, I want to let you know exactly what we're going to cover so you're not wondering where this is headed. First, we'll talk about what a referral actually is in plain language, no insurance jargon. Then, I'll explain what's changing in 2026 and, just as important, why it's changing. We'll go over the important dates you need to be aware of, including when these rules start and when they're enforced. After that, we'll talk honestly about what happens if a referral isn't done, not to scare you, but so there are no surprises. And finally, we'll wrap up with what you should do going forward and how our team at Thomas Family Insurance helps make sure this doesn't turn into a headache for you. By the time we're done, you should feel comfortable with how this works and confident about what to do next. Let's start with the most basic question: what is a referral, really? So, when we talk about a referral, here's all it really means. A referral is your primary care doctor saying, yes, this patient needs to see a specialist, and letting United Healthcare know that decision was made. This is important. The referral isn't something you hand to someone, and it's not a form you're responsible for. It's submitted electronically by your doctor's office directly into United Healthcare system. And this is where people get tripped up. If that referral isn't actually entered into United Healthcare system, then from the insurance company's point of view, it never happened. Even if you talked about it with your doctor, even if it's written in your chart, and even if the specialist appointment is already on the calendar. That doesn't mean anyone did anything wrong. It just means the system didn't get the message it needs. Up until now, that hasn't caused many problems for a lot of people. But in 2026, this step starts to matter a lot more, and that's why we're talking about it today. So let's move into what's actually changing next year and why United Healthcare is making this shift. So now that we've talked about what a referral actually is, the next question is obvious. Why is this changing in 2026? Over the years, Medicare Advantage plans, especially HMOs, slowly moved away from what they were originally designed to do. A lot of people were able to see specialists directly without their primary doctor really being involved. On the surface, that felt convenient, but over time, it created a real problem with coordination of care. I'll give you a simple example. A person could be seeing 6 or 7 different specialists, sometimes in different health systems, sometimes even in different states, and each one of those doctors is focused on their own specialty. None of them are looking at the full picture. The cardiologist is worried about the heart. The pulmonologist is worried about the lungs. The orthopedic doctor is worried about joints. And meanwhile, your primary care doctor may not even know who all you're seeing or why. The referral requirement brings your primary doctor back into that role of quarterback. It makes sure they're aware of who you're seeing, what you're being treated for, and how all of those pieces fit together. And that matters, especially on Medicare, because better communication between doctors leads to better outcomes. Fewer medication conflicts, fewer duplicate tests, less guesswork. This isn't about penny pinching or making it harder to get care. It's about slowing things down just enough to make sure your care is coordinated, intentional, and centered around you as a whole person, not just a list of conditions. That's what a true HMO structure was always meant to do. and that's why referrals are becoming important again in 2026. Next, let's talk about the timing, when this starts and when it actually begins to matter. So, when you boil all of that down, here's what's actually changing in 2026. Most United Healthcare Medicare Advantage HMO and HMO POS plans will once again require referrals for many specialist visits. This doesn't mean every specialist, and it doesn't mean every situation. We'll talk about exceptions later, but it does apply to a lot of the specialty care people receive. The key idea to remember is this: your primary care doctor is being put back at the center of your care. The referral is simply the tool that keeps your care coordinated through that primary doctor, instead of being scattered across different offices that don't always talk to each other. So if you take nothing else from this slide, remember this: referrals aren't being added to slow you down. They're being used to make sure someone is actually looking at the full picture. These dates matter because the rule change and the enforcement don't happen at the same time. January 1st of 2026 is when the referral rules officially begin. That's when doctors are expected to start submitting referrals for specialist visits that require them. From January through the end of April, there's a grace period. During that time, United Healthcare is not denying claims just because a referral is missing. That window is there so doctors' offices can adjust and learn the process, and so patients aren't caught in the middle while everyone gets used to the change. May 1st of 2026 is when enforcement begins. From that point forward, if a referral is required and it isn't on file, the claim can be denied. So the takeaway here is simple. Early in the year is about adjustment, but by May, the referral really needs to be in place. Next, let's talk about what actually happens if that step is missed. This is the part people usually worry about, so let's slow this down and be very clear. After May 1st, if a referral is required and it isn't on file, the claim for that specialist visit can be denied. What I want you to hear clearly is this: you cannot be balance billed for that. In other words, this is not a situation where you suddenly get stuck with a big medical bill because something was missed. The responsibility for the referral sits with the doctor's office, not with you. That said, denied claims still create problems. They can lead to delays, rescheduled appointments, and a lot of unnecessary back and forth between offices. That's why this isn't about blame, it's about prevention. Catching this ahead of time keeps your care moving and keeps frustration out of the process. Now, let's talk about what you should actually do going forward and how we help make sure this doesn't become an issue for you. One important thing to keep in mind is that this change does not mean you suddenly need referrals for everything. There are still many services where a referral is not required, even on a Medicare Advantage HMO plan. You never need a referral for emergency room care or urgent care. If something feels urgent or serious, you go get care. No extra steps, no phone calls first. Mental health visits also do not require referrals. That includes counseling, therapy, and psychiatry. OBGYN visits fall into that same category. No referral needed there either. Most therapy services don't require referrals, including physical therapy, occupational therapy, and speech therapy. Routine labs, imaging like x rays or MRIs, and preventive care, things like annual checkups, screenings, and wellness visits, also do not require referrals. So, this is not a blanket rule. It's targeted mainly at certain specialist visits, not day to day care. And if you're ever not sure whether a referral is required, don't guess. The easiest thing to do is ask one simple question before the appointment: does my plan require a referral for this visit? You can ask that question at your doctor's office, or you can call us. We'd much rather help you check ahead of time than have you deal with confusion later. Next, let's talk about what you should actually do going forward and how we help keep this simple for you. I also want to say this clearly because it matters. This referral system is much more of a provider workflow issue than it is a patient issue. The responsibility for submitting referrals sits with the doctor's office, not with you. You're not expected to manage paperwork, track systems, or understand how referrals are entered behind the scenes. From your perspective, your role stays very simple. You see your primary doctor, they guide your care, and if a referral is needed, they handle it. So if this sounds complicated, that's because it's complicated on the provider side, not because you're supposed to carry that burden. Our job, and your doctor's job, is to make sure this works smoothly without it becoming something you have to worry about. And if something ever feels unclear or doesn't sound right, that's where we step in. You don't have to stress about this. We've got this. I want to be very clear about something before we talk about verification. I personally do not believe you should feel responsible for double checking that your doctor is doing their job. The referral process is part of the provider's workflow, not something you're expected to manage. In most cases, you can simply assume your doctor's office is handling it because that is their responsibility. If a referral is required and it isn't submitted, that headache belongs to the provider, not to you. Now, if you're the kind of person who just likes peace of mind, or if you're feeling unsure before a specialist visit, there's a very simple way to check without turning this into a project. You can call the specialist's office and ask one straightforward question: has my referral been received? If the referral hasn't been turned in yet, the specialist's office may choose to reschedule the appointment until it's on file. That can be frustrating, but again, that's part of the provider process, not something you caused. And remember, early in 2026, we have that grace period. This is a learning curve for offices as well, and there's time built in for procedures to get ironed out. So the big picture here is this: you don't need to stress about this, you don't need to chase paperwork, and you don't need to play middleman between offices. Your job is to get care, their job is to coordinate it, and our job is to help when something doesn't feel right. That's how this is supposed to work. And this is where we fit into all of this. When something doesn't feel clear, or when the system doesn't work as smoothly as it should, that's when you lean on us. Our role isn't to complicate things or send you chasing answers. It's to step in, explain what's going on in plain language, and help get things back on track when needed. Most of the time, nothing will be required from you at all. But if there's ever confusion around a referral, an appointment, or a claim, we're here to help sort it out before it turns into frustration. This isn't about rules or paperwork. It's about making sure your care keeps moving forward without unnecessary stress. So you don't need to manage this system, and you don't need to worry about whether you're missing something. You focus on your health. We'll help handle the rest. Before we finish, I want to leave you with just the most important points to remember. In 2026, many specialist visits on Medicare Advantage HMO plans will require a referral. There's a grace period early in the year while offices adjust, and enforcement begins later in the spring. If a referral is ever missed, you are not billed for it, but it can slow things down, which is why awareness matters more than worry. Most of this happens behind the scenes. Your care still starts with your primary doctor, and the referral process is handled by the providers involved. And if a question ever comes up, you don't have to guess. That's when you reach out. This is Rick Thomas with Thomas Family Insurance. Thank you for taking the time to watch this, and thank you for allowing us to serve you. God bless.